Well, no matter what time of year it is, I am more than willing to help spread the message about breast health. As you know, though, October is when so many people raise the volume, so to speak, on that message for Breast Cancer Awareness Month. And that is why I am so pleased to welcome two experts in that field who work tirelessly every day to help women reduce their risk. We have Dr. Bridget O'Brien and Dr. Shilpa Padilla. They are both surgeons with Mount Carmel Breast Surgery, so I want to welcome you to Daytime.
Thank you. Thank you so much for having us.
So both of you are lead surgeons at Mount Carmel Breast Surgery, so kind of tell us what the center is all about.
We have a nationally accredited breast cancer center. We really pride ourselves in treating the patient, making them come first, and working together with the other specialists in breast cancer care to provide the most excellent and up-to-date care for those patients.
Yeah, as we know, it takes a team, so it's good to know that you have a great one behind you. So, Dr. Padilla, there's such an emphasis on early detection, as we all know, against breast cancer. So what do women really need to know? What do they need to do to make early detection possible?
It's really important to remember what the national standards are. Recently, it's been in the news that there's been some controversy over when women should start their mammograms, and what's really important to remember through all of that is the national standards have not changed, despite what some people and somewhat medical groups have come up with. And so it's still recommended by national standards that women starting at the age of 40 get yearly mammograms. We also recommend and want women to be self-aware. What that means is you know yourself better than anybody. It doesn't matter if you get examinations, those are really important, but knowing yourself is just as important.
Sure.
So if something were ever to come up that just seemed abnormal to you, that's really important to get questioned. Ask your doctor, hey, what's going on? Is there something here? Because that feels abnormal to you.
Right. It's always best to know. I was 27, felt a lump on my own and went in,
right.
No family risk or anything. So you always have to be your own advocate.
Exactly right.
People.
Yes.
So, okay, Dr. O'Brien, are there some women who may require more than just that annual mammogram?
Yes, there are some women that we consider to be at high risk for breast cancer. It is important for a woman to know their family history, not just their mother's, but their father's family history as well, and provide that information to their doctor. If they have a family history with breast cancer, ovarian cancer, or even some other certain kinds of cancers, particularly at younger ages, less than age 50, it is important to start screening those women earlier if they qualify for MRIs and mammograms, and then provide genetic counseling and testing for them if they qualify.
Okay, all important stuff. Okay, Dr. Padilla, what are some of the ways that women can reduce their personal risk? Some tips.
What's really important to know is the majority of breast cancers are fed by estrogen, meaning they eat estrogen and they grow based on that. So what women can do is how can we modify the amount of estrogen that is in our bodies, basically. There are things we can control and things we cannot, but one thing that's really important is excess body fat. We know that excess body fat makes estrogen. So even after menopause, when your ovaries have stopped working, that excess body fat increases the amount of circulating estrogens, which then increases your risk of. So healthy diet and exercise are really important. We know that tobacco use and alcohol use are directly related as well, so decreasing those amounts in your life will also help. And one thing that's also really important is vitamin D. Vitamin D has been proven to be directly related to breast health, so all women should be taking a vitamin D supplement, and as you know in Ohio with our lack of sun, yes, it's even more important for these women.
So what are some of the advancements? Because we know there are tremendous strides being made every day.
Right, so breast cancer and breast cancer treatment is ever evolving, and the goal always in surgery is to remove the cancer, right? That's the #1 goal. But as research is happening, we're realizing that the #2 goal, which is very close behind #1, is ensuring that the woman feels normal again, is ensuring that cosmetic outcome. We know that the most defining portion of a breast is the nipple. And so in some women, it's been studied that we can actually remove all the breast tissue, but leave that nipple behind so that when that woman looks in the mirror, she gets the best cosmetic result and isn't always reminded that she had breast cancer.
Yeah, that is big, definitely. And Dr. O'Brien, what about women that want to preserve their breast?
If they want to preserve their breast, we have new techniques such as hidden scar techniques where we no longer have to make the incision directly over the cancer in the middle of the breast. We can make it on the side, under the arm, underneath the breast, around the areola, so that it's very well hidden and not easily seen. We also fill in the defect where the cancer was taken from so that they're not left with a deformed breast.
Okay, let's talk about some of what you are, what you do on a daily basis. You're a surgical oncologist, so can you kind of explain what that means and why patients should look for that distinction?
Sure. We trained general surgery residency, and in that we learned everything about surgeries, but we weren't able to concentrate on breast cancer specifically. So we've done extra training through a fellowship where we were given the opportunity to also do specialization in medical oncology, which is chemotherapy, radiation, breast imaging, pathology, genetics, so that we could really develop our breast cancer treatment knowledge base. And then we also developed our surgical skills in these oncoplastic techniques that we've talked about.
And that's important. It's important to look for that because you want the best possible outcome in every way.
Right. One thing to really remember is breast cancer is one of the most changing cancer treatments, and when we look at the whole gamut of cancers out there, there's so much research behind it because it affects so many women. And so being able to go to a specialist that's able to stay up to date, this is all we do, this is what we love. And so being able to go to someone who can stay up to date with all those treatments is really important to make sure that if you unfortunately get breast cancer, that you're getting the best treatment there is.
All right, well, we want to thank you for what you do because you save lives every day. So thanks for being here and sharing that with us.
Thank you.
Thank you so much for having us.
Well, up next, your most precious investments are your home and your family, pretty likely. So we will get a look at some tools that will help protect both of them from a fire.